So UCT has an obligation to comply with public health policy, and we have legislation as a country that requires public institutions to have a smoking policy. It's also about creating a safer and healthier space for the university community. And I think it's also about protecting the rights of non-smokers and their right to have a safe and healthy environment in which to work. So in terms of what the policy says is that if there's a violation of the policy and people smoke in restricted areas which are clearly demarcated as such, the comeback will be that it will be dealt with in terms of UCT's disciplinary procedures. So the legislation allows for the employer to provide designated areas, but in terms of the UCT policy, we've opted to not actually promote designated smoking areas. In fact, what they're going to focus on is clearly demarcating the restrictive areas, which is actually a very, very big part of the campus. It's all the physical spaces, it's all the entrances and all the areas surrounding even the lecture theatres like the stairways, etc., where people are likely to congregate. It speaks about service areas, so that could be your cafeterias and even service lines, your queues at your bus stops. Those are all public areas where no smoking will be allowed. So the university has gone to great lengths with the policy to rather focus on clearly demarcating which areas are restricted areas and where the policy will be very stringently applied. It has opted to actually not create designated areas within that restricted area. So people will not be able to smoke anywhere within those restricted areas, which is a very substantial part of campus from my reading of the policy. So vaping is just a different way of delivering nicotine because it's tobacco products, and the university has opted to deal with it exactly in the same way. There are sort of, grey areas. We don't know, it's very new, those products, but we do know that it essentially delivers very much the same toxins and the same substance as nicotine, for example, as conventional cigarettes. It's just that we don't know much about the long-term effects as yet. There is sound evidence that suggests that good public health policy, such as smoking legislation, it does lead to a decrease in the number of cigarettes smoked by people, and it does lead to increased rates of people quitting smoking. So it actually has potentially a very good impact on public health generally.